Go ahead. We're going to show you a release of the iliopsoas muscle, or a psoas release, which is extremely helpful for horses that show up with tender or sensitivity in the sacroiliac joint, like this. Another thing that you'll see is they'll be reactive when you go to the top of the rib, the last two ribs. If you go to the rib head and push down, you'll get this fasciculation, and it should be bilateral. So I promise you that on this horse, Colin, it is. And then the last thing you can do, sorry about that, is you can get behind the horse and get right in front of the tuber cocci and squeeze, and the horse will tip his pelvis down if their psoas is tender. So this horse is really showing psoas. The iliopsoas muscle is a deep internal stabilizing muscle of the pelvis, and it attaches from the inside of the coxofemoral joint. So this is the femur, and there's the coxofemoral joint, or the ball and socket joint, like dogs with hip dysplasia. That's the joint that gets affected. And it starts from the inside of the coxofemoral joint, goes through the pelvic canal, and it attaches underneath the lumbar vertebrae, and it also attaches to the last two thoracics. And so that's why you get that tension when you hit the last two ribs. So a lot of horses that show back soreness it's really an inside job. It's an internal pull of the psoas muscle, more of a psoas pain and strain than actually a chiropractic issue. So Dr. Kerry Ridgway is a mentor and friend of mine, and he taught me the psoas release. It takes two people. Jess, you willing to help me?
You got it.
And it's better if we get the horse standing a little bit squarer in the back end. And you get your hand right on the shelf of that tuber cocci there. There's a little shelf, and you put the palm of your hand in there, and you use your core. You want to use your core abdominal strength for this, not just all the tension in your shoulder. And the two of you push back simultaneously. So if you've never done this before, you'll start softly. This horse gets this regularly, so he's used to it. So Jess and I are both in there and pushing. And as the horse gives more, sometimes you'll feel him push against you. And the other thing you'll see is the horse will start to take big abdominal breaths, big belly breaths. Nice, Colin, just like that. And you know that is getting the psoas release, because the psoas is attached anteriorly to the diaphragm. So one of the keys is to get as close to the horse's body, because Jess and I are not pushing against one another. We're actually both getting on his pelvis and pushing it up and backward, as if he had a flag on the tip of his tail. So if we're too far out here, then we're just pushing against one another. So you want to get as close to him as you can. And again, use your core. And as a horse really pushes, sometimes I feel like I'm a little torpedo, and I'm doing a kind of a yoga exercise like plank or chaturanga. So the other thing you can do is, because this is about a 2-minute stretch, is you can stretch, like one leg, your hamstring, and then your other leg. And you can also change your palms and change your hands if they get tired. So that is the psoas release. It's a little bit boring, but I have had so many positive results in sacroiliac pain. Horses that used to get trochanteric bursa injections don't have to have that anymore. Horses with chronic low back. So the psoas release on this horse, and on most horses, I like to see it be done 3 times a week, or as needed when you do those 3 simple checks that we started with: checking the sacroiliac, checking the caudal ribs, and getting behind them and getting in front of the tuber cocci and just doing that little pinch test. Some horses will start to wiggle a little bit back and forth, like that. And some horses will just step off when it's time, but in general we'll do it for 2 minutes. How you doing, Jess?
Good.
Okay. All right. For psoas reactivity, if it needs to be done, is you get right over the sacroiliac joint, and if you get that kind of reaction, that would be a positive. And then you come here on the caudal ribs, and you squeeze down, and you'll get that fasciculation, and it should be bilateral. Can you do that, Jess, on the other side? You get on the top of the last rib and squeeze down. Let's see if you're on the right spot. Here's the last rib. You want to go right on the rib head. Right there. Okay. So you're a little bit high. And then the last thing and stay right where you are, is you get behind the horse and go right in front of the tuber cocci and squeeze, and you'll get that little, that work out? Mm-hmm. Cool.
Yeah.
A very natural inclination and another great postural exercise is called the rib game, and it just lends itself to go from the psoas to the rib game, or from the rib game to the psoas, depending on how much pain the horse is exhibiting. But as I said, that psoas attaches to the last two thoracic vertebrae and attaches to the diaphragm. So a lot of horses that have psoas tension will also be a little bit tight in the rib cage and their diaphragm, and maybe even holding their breath. So this is the rib game, and I'll take a deep breath in, and I'll exhale, and I'll send his belly over to Jess, and she'll send it back to me. Nice. And the goal here is to do just what he's doing, keep his feet on the ground and move his rib cage. So he's doing a really good job. This has really got him. I would guess this horse prefers to turn right than left.
Yeah, I think so.
Okay. So that's the rib game. We do that about a half a dozen times. And that's enough.